Hello. So since my last video update on the BEVA Council committees, today, the 29th of February, the Health and Medicines Committee met, and we met virtually, which means we can be in the much more familiar surroundings of the countryside rather than in central London. And as a result, I put my green trousers on today so that I would blend in with all the grockles around here. So what did we discuss? So the first thing is Jenny Hall gave us a presentation on behalf of the FEI on the process of getting drugs listed on the FEI Clean Sport app, either as tolerated drugs or as controlled or banned substances. Now there is a process here as an annual review of these drugs, and it begins on the 1st of March. It's a fairly complex system. You've got to put in a properly evidence-based and literature-based suggestion for it. The Dutch this year have put in a suggestion for pergolide to be a permitted drug. That is reviewed at the start of March on their committee, and ultimately it goes through the process and is ratified by the board meeting of the FEI in September. So we as BEVA took this on board. We're happy to do in many ways, the representation of drugs. If any members feel there are drugs that should be either banned or tolerated, we'd obviously want, we will review the choices, but we're happy to do the legwork of putting this forwards. And just so you know, 1st of March is our day, and we'll obviously need some significant time. And we'll be advertising this in BEVA News in October, November, as to what, does anyone have any suggestions of drugs that could go on this. And then the next thing we discussed, which probably took up the majority of the meeting, was antibiotics and the use of antibiotics. We feel that there is now a fairly clear-cut methods for monitoring antibiotic usage. These have been published both by Tim Mayr's group and Rose Talon have published these, but they're established techniques out there. And the debate now is what happens with this data going forwards. There are pretty much 3 sort of data monitoring organizations, and probably the one that is most involved with antibiotic monitoring is the RCVS Knowledge. RCVS Knowledge is separate to the RCVS. It's an independent charity. They have been developing software so that they can automatically get antibiotic update from practice management systems. And they can do this effectively with Eclipse, with VetIT, and with RoboVet. Before they start to roll this out, they want at least another 3 practice management systems so they can review these and get these working and make sure they're doing it, so they can hopefully get a very large proportion of equine practice in the UK. So if you work for or you use any of the other practice management systems, we would like to hear from you, and we will put you in touch and try and get this project going forwards. And in the meantime, what we'll try and do is keep collecting the data that we've had, and we'll submit that to the VMD. They published the Rose Talon paper. They did publish that in the VARS report, the Veterinary Antimicrobials Resistance and Sales Surveillance Report. And so we'll hope to provide data for 2022 for them as well for the next report. And then anthelmintics, that really took up the rest of the time. Now the Canter project, many of you have been involved with this. That is going well. In fact, it's reaching the conclusion. The draft guidelines are going around now, and the full guidelines should be coming out for publication in June. As for the status of anthelmintics, with the veterinary medicines regulations review now being done, the prospect of these becoming prescription-only medicines has largely gone for the time being. Regulations have tightened up for SQPs, for suitably qualified persons, and in particular they're going to have to keep records comparable to records that veterinary surgeons would keep. We did review also some slightly sharpish practice. In particular, we had some a report from one of the internet suppliers of worm egg counts, and they had provided the results with high levels at the levels that we would consider to be medium at best as veterinary professionals. And these were associated with links to where you could buy wormers directly from, presumably their preferred provider, if not themselves. And we felt that this was definitely sharp practice. This was, beyond what would be permitted for veterinary surgeons to do. And we decided that we would probably be forwarding this to the Veterinary Medicines Directorate for their opinion of it. That was the majority of our work. We will be meeting again just before the main BEVA meeting in summer, so probably late May or June. And if you have any concern on health or medicines, then do let one of us know. Thank you.